fertility expert who's bringing breakthrough technology to couples right here in the Cleveland area. And they've already had a child. And some couples having a child seems like an impossible dream, but new technology is giving hope to couples who can't conceive on their own. Dr. Ricardo Loret de Mola is a fertility expert from University Hospitals, and he joins us now with a look at fertility breakthroughs available right here in the Cleveland area. Good morning. Thanks for joining us.
Thanks for inviting me.
Well, tell us about some of these breakthroughs that could give some would-be parents hope.
Well, a few of the things that we're doing today is that we are more able to predict which embryos, in other words, the babies to be, are more likely to actually implant in a mother and actually give a baby, because we have extended the period of time of the culture of the embryos to be able to pick the ones that are more likely to end up in a successful pregnancy.
And then you just watch how they develop and choose from there before you implant it.
Exactly. By extending the culture period, we're better able to predict which ones will be successful.
Now, is this successful or have a decent, pretty standard success rate no matter what the infertility problem is?
There are certain things that we're more likely to be successful at treating than others. People that have tubes that are obstructed, for example, patients that have unexplained infertility. In other words, after a complete workup, we're unable to find a reason for them to get pregnant.
How long has this type of technology been around? I mean, we've heard of in vitro fertilization for a while, but how long has this type been around?
Well, in vitro fertilization started in 1978 in England, and since then, we've been able to be more successful at extending the period of culture of the embryos to be able to pick the best ones.
If a couple is having problems having children, when should they consider something like this? How much time should they give before they think they need to go for some special help?
Well, we generally advise couples that after a year of unsuccessful trying to conceive, to start talking to their doctors about it. They generally go through a period of diagnosis, which generally takes between 1 to 6 months, depending on the specific condition. And then after that, initiating some fertility treatments, which could vary between 3 to 6 months too. And at the end of that period of time, if they have not been able to conceive, they should consider in vitro fertilization as a choice.
In many cases, is the problem more with the woman or with the man? Or from what I've read, it generally is pretty even as far as which side the problem is on.
That's absolutely right. Basically, 50% of the problems are related to women, and the other 50% are related to men. So,
is this a costly procedure, and does insurance pay for something like this?
Well, unfortunately, it depends on the insurance plan. Some insurance plans do cover it, some don't. In the state of Ohio, we don't have mandates for coverage, unfortunately. So it depends on the particular insurance company and the particular insurance plan that the employee belongs to.
What about risk factors? Are there any risk factors involved in this?
In infertility?
In some of these treatments?
Well, the risks are actually minimal. The treatments are very simple in these days. Patients don't have to go through general anesthesia anymore. Basically, they have a little bit of sedation, so they're comfortable during the procedure. It lasts about 30 minutes. And the risks are associated with any other minor surgical procedure, like infection or bleeding, but they're minor.
All right, well, giving more hope for people who are having problems having children. Dr. Ricardo Loret de Mola, thanks so much for joining us this morning.
Thank you for inviting me.
All right. Well, if you are still waiting